All right, guys. So the quiz will be starting at 10 p.m. That's a good counting number. You've reached your half century. 50. 50 quizzes, doc. That's great. So we'll be starting the quiz at 10:10 p.m. 3 minutes more to go. Last 3 minutes to join the quiz. Last 1 minute to go. So there are a few questions which will require extra time. So we're giving extra time as well. But you have to solve it between your 60 seconds. So try to be quick. Remember, there are no negative marking. You are free to click away your answer. And remember, the fastest finger first will be on top of the leaderboard. And I hope you guys are ready because it's 10:10. So we can start the quiz, I guess. Yeah. So let's get started. Keep the music on loop, you guys. All right. So let's go. All right, let's start. So your first question. A 45-year-old male presents with fatigue, hyperpigmentation of the skin, and persistent hypotension. Laboratory tests reveal hyponatremia, hyperkalemia, and a low level serum cortisol level. Which of the following is the most likely cause of his condition? Let's see, what do you have here? You have pheocytochroma, and then Addison, then Cushing's, then Commons. Which syndrome is it? You can pick out your particular points on these diseases, and I think that will help you out. Mostly not Cushing. Could it be? Could it not be? Let's see what you got. All right. So I hope you guys are ready. Let's hear the drum roll. And what is it? Perfect. All right. So most of you have got this answer right. And that is Addison disease. Let's see the leaderboard now. Oh, so Thor, then Aditi, Krishna, Myra, Aki, Bhagya, Naga. Just a second. Yeah. Then Aisha, SP, Ramakrishna, S, Syed, Emmy. Guys, this is a start. Don't worry at all. You have many more questions. So we have kept around 20 questions since it's a grand finale. So making it that way, let's move on to your next question. A 55-year-old man presents with palpitation, sweating, and episodic headaches. His blood pressure is 180 by 110, and urine analysis reveals increased metanephrin and vinyl VME. A CT scan of abdomen shows a well-defined adrenal mass. What is the best initial treatment? So over here, we're asking you the initial treatment, and that would be, wonderful. So confetti for you all for answering quickly. Let's see what you have. It's a mixed batch, but most of you have got this right. That is alpha blockers, initial management. So what is the diagnosis, guys? If you can comment in the YouTube section till we see the leaderboard, let us know what is the diagnosis. All right. So what do we have? Leaderboard. See, I told you it's a start. So let's keep the pace. Yeah. Moving on to your third question. A male presents with recurrent episodes of oral ulcer, genital ulcers, and uveitis for the past 2 years. Examination reveals erythema nodosum on the legs and positive paternity test. What is the most likely diagnosis? Ramakrishna has answered the right answer. That is for you. Very good. And then we have Tanya also. So wonderful, guys. Ooh, you guys are getting quicker. Nice, everyone. Great. So confetti for you all. Wow. All right. So which is disease is the right answer. Let's move on. Good. You guys have come prepared. I like you. All right. So we have the longest streaks now, and then the tops. So you guys, you're doing great. All of you are doing great. All right. Let's see. Fourth question in front of the screen now. A man has burning pain and numbness in both feet, worsened over the past few years. He also has difficulty in feeling hot, cold temperature and has noticed small painless wounds on his feet that take a long time to heal. On examination, loss of ankle reflexes and impaired vibration sense. What is the diagnosis? Let's see. Could it be small fiber neuropathy? Could it be Guillain-Barré syndrome or B12 or Charlotte-Marie tooth? Damn, guys. Nice. Very nice. Ah. I mean, yeah, I get it. You guys have thought, but it wouldn't go for the delayed healing time also, no? So, and then reflexes also lost, so that can't go for the B12. Small fiber neuropathy is the right answer, right? So, moving on. Nice. So, we have Myra, who has the longest streak, along with being on the top of the leaderboard. Wonderfully done, guys. Wonderfully done. Let's see. Aisha, Thor, SP, Bhagya, Rimshim, maybe. All right. So great, guys. You're doing great. Let's keep the pace up. Moving on to your fifth question. A 42-year-old factory worker presents with intermittent numbness, tingling, and color changes in his fingers. He has been working with vibratory machinery for past 10 years. He develops episodic finger parallel cyanosis and redness triggered by cloud. What is the most likely diagnosis? Guys, this is baby, neonate, turant aana chahiye. Like, and this has been asked. This has been asked in the previous I guess, previous only. And then once, let's see, okay, before me telling you all, let's see. Nice, very well done. So there's no much to say over here. All right, so great going, guys, great going. Let's move on. As soon your quickie, let's see. So your question is, an elderly man with end-stage renal disease due to diabetes is scheduled for long-term hemodialysis. What is the preferred site for creating an AV fistula for long-term hemodialysis? Let's see. Do you get it? What is it going to be? Brachiocephalic, upper arm, femoral AV fistula. Okay. All right. Guys, I think slow down your pace maybe, because brachiocephalic कैसे for a long term hemodialysis patient would you go for brachiocephalic? That's a question. That's a no. You go for radiocephalic, that is your wrist. So let's slow up your pace, don't worry. Just read the question properly. Like, try to imagine the sides also, no? If it is visible, it's not visible. How does it go? Okay. Ouchie. Who has got this? Okay, so PP has got this. Nice, PP. Your seventh question. There's a 45-year-old woman with history of rheumatic heart disease present with fatigue, abdominal discomfort, and leg swelling. Examination reveals JVP with a prominent A wave, hepatomegaly. Auscultation reveals a mid-diastolic murmur. What is the diagnosis? What is the diagnosis? Is it mitral stenosis? Is it tricuspid stenosis? Is it pulmonary stenosis? Or is it constructive pericarditis? Which one? People who are watching this on YouTube also, you guys are free to answer. If you're not participating, that's harsh, but you should participate so that you have the real-time marks as well. So wonderfully done, guys. Let's see. That is tricuspid stenosis. Wonderful. Keep up the pace now, since most of you have got this right. PP is rocking with the longest streak. Nicely done. Then we have Myra leading the leaderboard, followed by RDT, then Ashish and Aisha, then Thor, RK, Ramakrishna, M, Krishna, S, M, Sai, Naga, SP, Bhagya, PP, Rim, Ram, Amygdala, SYD, and Suren. So wonderful, guys. Wonderful. Let's move on to your next question. That is, A 55-year-old man with severe tricuspid regurgitation presents with leg swelling, pulsatile hepatomegaly, and elevated JVP. On examination, this JVP shows prominent waves. Which of the following JVP finding is most characteristic of this condition? So we are saying there is prominent waves. Now, which prominent waves would you find in this condition? First of all, what is this condition? That I would like to know if you know. And then let's see if you can come up with the answer as well. Guys are fast. Very nice. All right. Okay, large V wave is the right answer. Let us see if you can know the right diagnosis. Giving you a minute. See, guys, if you knew what is this condition, that is why I asked you. Like, if you can come to a diagnosis, then you're able to come to the prominent thing also. All right. So, K, Myra, you're on top, followed by RDT, then M, then Krishna, Ashish, RK, Aisha, Thor, Ramakrishna, S, MA, Sensai, Bhagya, Naga, SP, Rim, PP, and Ram, Amygdala, Sayed, and Suri. All right, guys. So, going great. Read the question. And if you know the diagnosis, let me know. All right, so your question is, a 35-year-old man with mild persistent asthma is prescribed montelukast for symptom control. He asks if it can be used as a metered dose inhaler, like his salbutamol. What is the correct response? So a patient has come to you and he has persistent asthma. You prescribe montelukast. Now he has another question. And the question is, can it be like MDI, like a salbutamol? Okay, I hope this confetti is right for you all if you have answered the right one. Nicely done. So no, you will not give. And since montelukast is an oral leukotriene receptor antagonist, how will you explain this to a patient? Anyone? All right. Tables have turned now. We have Myra, RDP, Ashish, Thor, and Aisha. Wonderfully done. Let's keep the pace. We are mid in the grand finale. Here is your question. A 35-year-old woman presents with fatigable muscle weaknesses, especially in the evening, and difficulty in chewing and swallowing. Examination reveals bilateral ptosis and weakness that improves with rest. Which of the following is the most specific test for confirming the diagnosis? So you got last 10 more seconds to answer this. Let's see what you got. Okay, guys, as you say. Nicely done. So anti-acetylcholine receptor antibody test is the right answer. Very well done. Great going for Myra. Let's keep moving forward. So your question is, a 32-year-old woman presents with persistent fatigue, inability to breastfeed, and amenorrhea 6 months after postpartum hemorrhage. Examination reveals pale skin, low blood pressure, and loss of axillary and pubic hair. What is the most likely underlying pathology? We are over here, we're asking you the underlying pathology. Let's see if you can get it. Is it autoimmune hypophytosis, empty sella syndrome, or pituitary infarction, or adrenal insufficiency? Let's see. All right. All right. So most of you have answered it correctly. That is pituitary infarction. Very well done. Let's move on. Okay. Great going, guys. Great going. Let's see, moving on to your next question. Which of the following drugs are not responsible for QT elongation? Okay, the question is incomplete. Okay, the question is a little incomplete, but I think you get your answer as well over here. It's going to be just the question is only this much, okay, for you. Is which of the following drugs are not responsible for QT elongation? Is it anti-epileptics or is it antimicrobial? That's it. And Leclerc has answered the right one. That was Sheehan syndrome. Let's see. Nice. Antimicrobials, no, erythromycins are given, and anti-epileptics do not. All right. So, okay, great. Now, moving on to your next question. A young boy presented with a history of genetic disorder. On further inquiry, his father and grandmother had the same disease as well. Prior to his birth, the doctor had counseled the father that there is a 50% chance of passing the passing the deleterious gene to his offsprings, irrespective of sex. Now, okay, you've got so many options. Let's see which one. Can you come to the right one? Let's see, let's see. Right, it's autosomal dominant. Wonderfully done. All right, so Myra is still leading up the leaderboard with holding the longest string. That's great going. Then we have Aditi M. Then we got Sai, then Thor, Aisha, Ashish, Krishna, Ramakrishna, then S, then RK, Emmy, Amygdala, Rim, Bhagya, Naga, SB, PP, Ram, Sayer, and Sureen. Wonderful, guys. Wonderfully done. It's a great going for all of you. The next question is, the first child of a normal healthy couple was diagnosed to have cystic fibrosis. What is the percentage of chances for the second child to be affected? Now let's see. What do you come up with? Is it going to be 50? Is it going to be 75? Is this going to be 25? Let me just remind you, this is the exact question that had come in the previous NEET. Yeah, that's a NEET question. Let's see if we can get that right. Last 5 seconds to go. Can you get it right? I hope you have. Nice. So most of you have got this right. That is 25%. All right. So great going, guys. Great going. To your 15 question, this is your time. Just read everything. It's quite easy. Let me read out the first left-hand side and then on the right-hand side, okay? So your 4 options are autosomal recessive, mitochondrial, X-linked recessive, and trinucleotide repeats. And on your right-hand side, you have Duchenne muscular dystrophy, then you have cystic fibrosis, Leber's disease, and spinomuscular atrophy. Now let's see. Match them following. And you'll be marked partially also, don't worry. All right. Nicely done. So most of you, 15 people of you have got this right, which is great. Great. All right. Wonderful, guys. Moving on to the next question. That is, a 55-year-old man presents with persistent cough hemoptysis. You notice that he has moon-like feces and purple stria on his abdomen. On examination, a chest X-ray revealed a mass in the right lung. Which of the following type of lung carcinoma could be the cause of this patient's feature? Guys, another neonate question. Neonate, we mean it's easy because The question itself has its answers. So it has a lot of peculiar points right in front of you. I hope you get this one right. Let's see, do you? It's a drum roll time. Wonderfully done. Yes, it is a small cell carcinoma. Oof. I know. Right. So great going, guys. Great going. You all of them are answering and doing it. So that is great. Great going. What is the CPR? Look at your device. It's again a match the following. Let's see what does the left hand side say regarding CPR. How does the sequence go? Like what is the start? Then what is it? The most common cardiac rhythm seen in adults with sudden cardiac arrest, which is a non-shockable, and what is a shockable rhythm. On your right hand side, you have asystole, then you have CAP, then you have PVD, and you have PEA. I think it's pretty easy. Another neonate, but yet the same question has been asked in your NEET. Different types, but yeah. Let's see. Nice. 16 of you have got this right, which is great. All right. You guys, all of you are doing great. Just read the question, you'll be able to know. Coming up, the next question is, a 55-year-old construction worker who is a known case of sarcoidosis has now presented with polyuria, constipation, and myalgia for 4 days. An ECG was taken, which showed a short QT interval. Which of the following is responsible for this condition? So, which is it going to be? First of all, guys, if you just diagnose it and tell us what is the diagnosis, that would be great, because that would help you a lot to come into these singling out your answer. All right, confetti for all of you. Increased production of vitamin D is the right answer. Parathyroid hormone is not related in this condition right now. All right, so that is a great going for Myra. Then we have Ashish, who's also leading. Then we have RDT2, then M, Aisha, Krishna, Ramakrishna, S, Sai, Thor, RK, Naga, Rim, Ame, Amygdala, Bhagya, Said, PP, Ram, SP, Sureen. All right, guys, we're doing great. Now we're coming to the close of this finale. And don't worry, guys, if you're feeling sad, don't worry. It's okay. You can always go back to your notes and revise them. So don't worry. Coming up to your second last question, that is a patient with ascites, melena, and splenomegaly is diagnosed with portal hypertension. Which of the following is not an intrahepatic cause of this condition? Let's see if you can get this one. Okay, your options are non-alcoholic fatty liver disease, then amyloidosis, then schistosomiasis, then obstruction of thrombosis of portal vein. Not a cause, not an intrahepatic cause. Let's see if you can get it. That is right. Obstructive thrombosis of portal vein is not an intrahepatic cause for this condition. Can you come up with the condition? All right. Let's see. It's a great going. Yeah. Let's move on to your last and the final question for tonight's grand finale. An elderly male comes with a foul-smelling breath and dysphagia. A barium swallow X-ray is attached. What is the most likely diagnosis? Now, this one should be like, the quickest, like Turant. Because everyone, come on, I'm not telling you any kind of, yeah. But Chiari syndrome is the right answer, which was the previous question. Very well done. All right. Come on, guys. Let's see. Come on. This is like the babyest question in your radio, in your barium swallow study. It has been the same question that has been asked uh, in this recent 2024 only. Let's see. It's a drum roll for all of you now. Oh my god, great. Wow, perfect. Wonderful. So at least you're not missing out on your PYTs. That is great. That is great. So applause for every one of you. All right. Now let's see who has won. All right. So congratulations, Dr. Mayura. You are the winner. You've been a consistent winner for JuxtaMed quiz. That is also a great and a commendable thing to say. And then we have RDT and M. Congratulations for being the runner-up as well. And congratulations to all of you guys, as you guys have been great. And I have something last to show you is this. All right. So this brings us to the end of this quiz. Congratulations to all. And let's see you tomorrow. And we'll be having another grand finale. That's your anesthesia tomorrow. So I hope everyone is prepared and well done. All right. So stay tuned for tomorrow at 10 p.m. We'll get you back with anesthesia grand finale. All right. Good night.